Something that I find pretty often in patients that are presenting to my office is something called convergence insufficiency. What is that? Well, it's exactly what it sounds like. It's when you have an inability or insufficiency in the ability for your eyes to converge in to a near target. When we're engaging in things that are within an arm's distance of us, our eyes need to have the ability to converge onto whatever target that we're gazing upon. And something that's important about this is if you think about it, when our eyes converge, that's the only time when our eyes are doing completely opposite things. As in, if I look to the right, both of my eyes are moving to the right. And if I look to the left, both of my eyes are looking to the left. However, if I'm converging, one's moving to the left and one's moving to the right. Now, according to this article, convergence insufficiency is the most common binocular visual problem associated with blurred and double vision, headaches, and sore eyes that are exacerbated when doing prolonged near work, such as reading. And I can tell you that I was literally working with a gal a half an hour ago who was struggling with this very thing. She was in a car wreck a few months back, and during the exam, I had her follow my thumb. And as I pushed in closer to her eyes, they started to come in. And then all of a sudden, her left eye is coming in, and then it deviates all the way out. And her husband's sitting right behind me as I'm performing her exam. And I said, "Did you see that?" He goes, "Yeah, that probably shouldn't happen, should it?" And the answer is no, it shouldn't. But in regards to the patient population that I see, it's pretty common because of how whenever you sustain a head injury, your brain gets jostled about within your skull and it places a lot of torsional forces on the brain stem, which is the center in which these eye movement centers reside. It can also be common in the pediatric population due to developmental issues, but I don't really treat a whole lot of children, so we'll stick with the trauma-induced mechanism. Although, I think this is an important concept because for the most part, when a patient makes their way into my office, I've usually never seen them before. So I could be seeing an adult who, let's say, slipped on the pickleball court and whacked their noggin on the cement, and I notice that they have a convergence insufficiency that just so happens to line up with some of the other presenting symptoms. So realistically, this finding could just be an incidental finding and a developmental issue that they've had their whole life and they've never had any symptoms before with this. Why I think this is important is because I've seen this happen all too often where a provider will get tied up in a particular finding, like convergence insufficiency in this case, but what if I fix that finding and the patient doesn't feel any better? Well, what will unfortunately happen is providers will label that patient as a weird case, when in reality, we as human beings are complex machines. And usually things aren't as simple as one finding is always correlated to one symptom. So if this were you, I would now go back. I now wouldn't go back to you and say you're weird. I would just check off one possibility off of my list and say the door that we knocked on wasn't what we were looking for. So let's see what's behind door number two. But back to convergence insufficiency. If this is you, your eyes have an inability to converge together on a near point. Think about how impactful that could be, considering that we live in a world where most things that we do consist of us being fixated on a near point. I mean, think about it. Most people spend their whole day on the computer at work or on their telephone, and if your eyes cannot appropriately move in that manner, surely it would contribute to some sort of symptoms, right? According to this article, they state that eye strain and headaches are common ocular symptoms, and the main cause in persons aged 15 to 40 is convergence insufficiency. And they also state that many patients are supplied with glasses for eye strain without the causative convergence insufficiency being treated. The treatment in most cases is orthoptic exercise. So what are they talking about? Most patients are supplied with glasses, and usually what patients are given is what they call a prism. Prism lenses make it to where if I have an eye that's deviated, they bend the light so that as the image of my environment hits as it comes in, it hits the same position on both of my retinas. Here's the problem, at least in my opinion. Prism lenses are fixed within the glass of your spectacles. And remember, they're redirecting the light so that it hits the same position on each retina. However, let's use the example of this patient that I'm working on right now. Whenever she's looking straight ahead, her eyes are perfectly lined up, looking at the same exact thing. However, when she converges on a near point, about halfway in, her left eye shoots out. So if the prism is fixed within the lenses, they can't compensate for an issue that is dynamic, like in this gal. It wouldn't make sense because if the prism is bending the light at a certain angle when her eyes are here, which she doesn't need, they would need to bend the light at a completely different angle when her eyes are here. So again, what did they say in that last article? They state that patients are supplied with glasses without the causative convergence insufficiency being treated, and that treatment in most cases is orthoptic exercises. So that's why we here at Peak Brain Performance Centers will do a lot of visual training and actually strengthen the ability for the eyes to move in certain planes or directions and be able to hold that position for longer periods of time. Like for this gal that I have been referring to throughout this video, I've treated her a couple times now, and initially her eyes wouldn't really converge at all. You'd push in and her left eye would just go whoop, and slowly we have been able to get closer and closer, and it's taking longer and longer for her eye to want to deviate once it comes in.